So, we've used the word investment case quite a lot so far in this morning's discussion, and I just wanted to reflect on the fact that when I started working in the field of global health, it was completely unheard of. Nobody talked about investment case. So it's a little bit thinking, these are some introductory remarks, I'll come on to the slide in just a moment. It's a little bit just trying to think about why do we think now about an investment case. And I think it has to do with, really at global level anyway, thinking about the change from the Millennium Development Goals, which initiated around the year 2000, to the Sustainable Development Goals, which initiated around the year 2015. I say around. Officially, of course, it started on those years. But there's some kind of thinking process and inertia and momentum in thinking and activities that takes some time to shift. Now, and I think a large part of the interest in investment cases that we see now in health has to do with really this change from the Millennium Development Goals to the Sustainable Development Goals. So why would that be so? And there's a couple of sub-points that I want to touch on. And the first is that in the Millennium Development Goals, which included a number of specific health targets, our mindset was really in terms of thinking about costs. What does it cost to reach those targets? The targets were, kind of benefits in themselves. They were assumed to be things that were good, but we weren't thinking about how to value those benefits. If anything, what we did was we thought about what it would cost to reach these targets. So the targets were sort of preset, predefined by UN agencies, and now the rest of the world, including these specialized agencies and so on, had to go around chasing after these targets and figure out what it would cost. So simplistically, that's the kind of the logic of the framework of the MDGs. Now, I think very much to everyone's benefit, when we move into the Sustainable Development Goals, there's a number of lessons that have been learned. And one of them is that we need to shift in our thinking from counting up costs of the price tags of things. What does it cost to reach NCD coverage? What does it cost to reach the action plan goals? To thinking about the benefits and thinking about how to count and value these benefits. So not just doing things on the cost side, but also doing things on the benefit side. And that expression has a number of different sub-themes. People start to talk about moving beyond GDP, other ways of measuring social progress and national progress, other kinds of dashboard approaches to development that aren't looking at just GDP, which is, a benefit, right? But also looking at benefits in a new way that go beyond GDP. So all of this is to say that if a simplistic answer in terms of what has changed between the Millennium Development Goals and the Sustainable Development Goals, the world in which we're now living, is that we're not thinking about just costs anymore, but we're really thinking about benefits and how to value them and why are those benefits important for development. That's the key. So development means benefits. It doesn't mean just some kind of global targets. And I think there's a second element, which is that there's an increased level, I've said decreased focus on domestic financing here, but I could really have said for this slide, domestic ownership of the development agenda. The SDGs, the Sustainable Development Goals, are not something that was written in New York and presented to countries. It was something that was written by countries and presented to New York. So there's been an entire shift in the sense of ownership of development. The SDG, another thing I could say is the MDGs, the Millennium Development Goals. Is that, by the way, is it very awkward if I use these letters like MDGs, SDGs? I realize I'm talking to a non-English speaking audience, so I will try to avoid using letters and use English words, and just wave your hand if I'm saying something that you don't understand or that is not clear. So there's a shift in the Sustainable Development Goals toward domestic ownership at national level. That means that it's not just the UN agencies and the specialized agencies, it's national governments that own and operate the Sustainable Development Goals. They are their goals. They are goals defined by national governments. And that the UN agencies and the specialized agencies are really one of the administrative assistants to help governments reach these. And so that means that it's not about donor financing from rich countries to developing countries. Everybody is in the SDGs. So, I think these are just some of the key facts to keep in the back of our mind when we see now there's this cottage industry in investment cases. By cottage industry, I mean everybody is doing them across the entire health sector. I'm sure outside of the health sector, everybody is doing them. The NCD community, I would say, are kind of early adopters in terms of seeing the strategic benefit of the investment case. And I think that comes out of the fact that you had your 2010 high-level meetings in Moscow, moreover, before the Sustainable Development Agenda was really established. So you were early adopters and early leaders in the understanding that it's not just costs, but it's benefits. It's a multi-sectoral activity. It's all of government. It's not just limited to the health sector, that everybody has a stake in this, and so on. So these are some of the ideas that I think are important to bear in mind when we think about why do we do investment cases. In other words, it's an important question to be able to answer. It's not just so that we work economics into the health system, right? There's a larger agenda there that has to do with the fact that people are interested in measuring, counting, and valuing benefits. So now I'll switch to more traditional focus on the health system, which is our sphere of activity. And just to note that, whilst we are friendly to investment cases, let's not forget that the principal purpose of a country's health system is to provide high-quality health care. The principal purpose of the health system is not to produce economic output, economic benefits. The principal purpose of the health system is to provide health benefits. And these health benefits are some of the benefits that we care about for the Sustainable Development Goals. And as I'll come back to, these health benefits are some of the benefits that we care about when we talk about investment cases. Okay? So aside from these health benefits, it is true that the health system as an economic sector contributes to economic growth and produces a number of economic benefits. That's not its primary purpose, but those are spillover benefits that we get for free, so to speak, at no extra cost when we have a health system. So when we make the investment case for the health system or for the NCD sector in the health system, we should never forget, first and foremost, the health benefits, but as an extra added benefit at no extra cost, all these economic benefits that we're going to start to enumerate, and that in my subsequent talk, I'll go into much more detail about. So I'm intending to talk for, I would guess, how long have I rambled on for already? 10 minutes, I suppose. maybe another 10 minutes, and then I'll stop, right? Is that all right? We have agreement? That'll be fine?
Yep.
So, when we're talking about an investment case, therefore, we're talking about counting up and valuing those health benefits and counting up and valuing those economic benefits. There's something about, from an economic evaluation standpoint, that is fundamental. So when we think about how we do that, I don't know if there's a pointer. Is there a pointer in the room? One of these?
Electronic ones.
Yeah, I think I may actually have one in my bag. Just give me 30 seconds. But in the meantime, does somebody else happen to have a laser pointer? Nope, I'm afraid not. That one's gone into a different bag.
You might just have to walk over and point.
It's not terribly important. I will, for the sake of the video, I don't know what's going to be the easiest thing. I think I want to be on the microphone, but let's look at the top two elements in this pathways diagram. And I'm not sure how clearly you can see this, but you see on the left-hand side, everything sort of starts with the health system. And one of the first, sort of causal effects or impacts of the health system is in the box labeled number 1, that is called health, in the second column at the top. So that's what we've been talking about. And those health benefits can be valued in two distinct ways. What we call as a part of a full income growth, which is putting a value on health itself, or through improved labor supply and productivity, which is the second box. So let me just walk over there and use my hands just to make sure that the points are clear.
Someone at the back was just saying they're struggling to read the small text.
So the health system produces health, and that's what I've been saying in the last slide. But it also produces some economic benefits, okay? So when we think about how we count these up, we want to value them in some way for an investment case. The health benefits are sometimes called full income growth. The direct health benefits. The extra, at no extra cost, spillover benefits are things that have to do with improved labor supply and productivity and reduced health expenditure. So there are things that happen in the market economy. So I think those are the main points I wanted to make with that slide, other than if you start thinking about this in a logical framework, there are a number of distinct benefits that the health system delivers that can be evaluated in an investment case. There's no objection to doing it. At some point here, we're going to draw the line and we say everything below that we're ignoring. But there's a whole range of benefits that are health, non-health, market-valued economic benefits, non-market valued economic benefits. There's a range of things, and it's useful to have a logical framework, and that's what this diagram is attempting to present, is some kind of a causal picture of how, in a very high level way, how the health system creates a range of different benefits. And so, I think I've been speaking really to this slide. The first pathway, if you like, is what we call the health pathway. That's the principal purpose that we have a health system. And the full income part of that is so-called when people start putting a valuation on health gains. So you put some kind of a unit of account that is not a health unit of account, but some other kind of valuation, and you count that as a form of income. Now, second part of the health pathway is a set of effects that operate through, for example, labor markets, where people are more active, more productive, they live longer, they produce more. Those are all health benefits, because those are things that health gives us, either directly or indirectly. Now, if we want to look at this in terms of economic output, we have a variety of things in the health sector that add to the economic output because of the transactions that are associated with them. We hire people, we buy equipment, supplies, and services. We invest in capital, such as buildings and facilities, and we develop communications, logistics, and supply networks, social capital. When we have a health system, we have a whole set of transactions, buying and selling, that is associated with the health system. That is measured in the national accounts. Now, later on, we're going to come back to this, and we're going to see, depending on where you're standing, we're going to count those transactions as either costs or benefits. Depends on where you're standing. But it's worth saying that even if we had a health system that's doing exactly what it's doing now, but delivered zero health benefit, it would nevertheless have a range of economic impacts because of the transactions. And those impacts are a part of GDP. They're a part of growth. So this is a major shift for the health community. To think about the health community as a sector of the economy that is contributing to growth through the output and the transactions, the buying and selling that occurs in the health sector. The health sector, in fact, is such an important part of GDP that in OECD countries, it's around 10% of total output. So this is a major, major impact that we need to have on our horizon. It's no longer enough to talk only about the health benefits in health terms. We have to talk about economic benefits in economic terms. And it's also important because decision makers and policy makers want to know if more money is going to the health sector, is that a drag on the economy or is that contributing to growth? Right? So we have to be able to answer those questions. So some people have measured the impact of $1 spent in the health sector. And, you know, this is balance of accounts studies, detailed poring over transaction flows in the economy and looking at things like the International Standard Industrial Classification and massaging it to get those elements of transactions that are directly captured in what the International Standard Industrial Classification calls the health and social sector, which is 2-digit level 86, but then adding to that those subsidiary effects that result because there is a health and social sector. How much of those immediate effects are then knocked on indirectly through the rest of the economy? And so, long story short, this is in Germany. The result of these data are from Germany, where they've done this detailed accounting exercise. $1 spent in the health sector is worth about $1.77 in terms of overall output. Okay? And some of that is because of what we call indirect effects, and some of that is what we call induced effects. So indirect effects will be things like, well, your health sector doesn't necessarily include over-the-counter medicines, but that's an indirect effect. When you go to the doctor and he gives you a prescription, some of those will be written on a slip of paper that's reimbursable. Others you might pay for out of pocket. So those, let's say in this context, those out-of-pocket expenditures are your indirect effects. What are the induced effects? Well, the induced effects have to do with the fact that you've just increased your pharmacist's income And now that pharmacist is going to buy more goods and services in the economy. So just to say that when we talk about spending in the health sector, even in developed economies where there's a very developed health system and health sector, we get a knock-on effect from the dollar spent in the health sector that has been estimated to be about $1.77, worth about $1.77 in terms of total output. So, as I mentioned earlier, and I'm going to just flick through these remaining slides, and I think I'm about to finish. So just looking to Alexi and Nick to see if they're ready for me to finish.
You take your time to do what you need to do.
Okay. No, but I think these are the main points I want to make in this talk. I've droned on for about 20 minutes, and what have I said here? I've said that, why are we doing investment cases? Because we care now more about benefits than costs. Why are we doing investment cases? Because this is really a country-owned and country-driven process, so domestic policymakers need to know, is this a cost or a benefit? Is it a drag on their economy or a boon to production? So these are the kinds of questions that we need to know. And when we think about the health system, we have to have a richer causal framework in mind about the health system. It's not just a bucket that you throw money into. It's a bucket that you throw money into, and then that money goes into other buckets. That's the important point. Some of those buckets are measured in the market because people are going to be less days off work. They're going to work more efficiently. They won't go on early retirement and disability. Some of those are some of the other buckets. But some of the other buckets are just pure accounting exercises that has to do with the fact that when there's transactions in the health sector, a large number of people have more money in their pockets and are buying more goods and services. And it's worthwhile to think about measuring those extra effects. Not just stay with our traditional focus on costs and health, but think about, in a richer social picture that is tuned to the needs of the Sustainable Development Goals, how do we measure these other impacts? And so some of these other impacts, now I'm going to really flick through, and I'll come back to some of these, mainly those that are related to social protection, have to do with things like financial risk protection offered by the health system. But many of these things are things that we could take on. Here's the financial risk protection, which is part of social protection, which is protection against the risk of health expenditure. And that has to do really when there's a kind of social insurance system or health insurance system where a large part of health services are not being paid for at the point of delivery out of the person's pocket, but have been prepaid through tax revenues or through employer contributions and pooled in some fashion so that they're purchasing the services in a more efficient way. So those are important benefits that are realized by a health system that we can count up, and sometimes we do count up when we do investment cases. The rest of the things are some of the other elements on that initial slide, which have to do with things like, toward the bottom in the second row from the left, social cohesion, innovation and diversification, and health security. Social cohesion, innovation and diversification, and health security. Now, just one final footnote. The health security, what does that mean? It means when we have a functioning health system, we don't have an Ebola outbreak that goes global. That's health security. Health security is really about SARS epidemics, H1N1 epidemics. How does the health system react to, identify, control, and contain? There's a health security benefit that is worth, according to the Academy of Medicine in the United States, at the global level, at least $60 billion a year in expected value. So that means, when you look at really catastrophic benefits and you annualize them, you're going to want to be paying a lot more than we're paying for that particular benefit, which in some countries is nearly zero. So I just thought I'd mention that last one because it's an interesting one when you think about the different benefits delivered by the functioning health system. The health security benefit is really a quite substantial one. So with that, then, I will well and truly stop for now.